So today I've got a 20 to 25-minute presentation on NGB-R, of course, which is the bioprinting platform that we've got here at Poietis. But we're going to take this opportunity to tell you more about the disruptive cytocentric approach to bioprinting that we have and how to make the most out of the instrument. Before I start, please allow me to very briefly introduce Poietis for those of you who are not familiar with the company. So it's a 6-year-old company that was started in 2014 in Bordeaux. I don't know if some of you like red wine. It's kind of the French capital of wine in Southwest France. But it's also pretty popular for laser technologies, surprisingly. And so it's about 6 years old, and we've got roughly 15 years of experience in bioprinting, but specifically with laser-assisted bioprinting, which is a technology that we've developed here. And to date, we've filed about 52 patents, most of which are actually technology-related. So initially, Poietis was specialized in human skin tissue models. That's a type of tissue with which we've had different partnerships and customers. But since 2016, we've expanded that kind of field of expertise with different customers and partners. So we've started working on hair follicle with L'Oreal. We worked on liver and pancreatic tissues with NGB-R as well. Also on brain models and organoids as part of neural disorder studies. And more recently, we've also started working on cartilage tissues as well. Just one last slide, and well, the main takeaway here, guys, is that we don't just manufacture instruments. To me, that's a really cool thing, because we've got a 38 people team here at Poietis, who most of them are biologists and engineers, and that usually help customers with pre-sales research, validation, for example, after sales assistance, of course, but mostly ongoing support. So that includes, for example, any recommendation on laser parameters for your cell types or applications. So more than an instrument, actually, we really want to share the experience that we have and help you, save time and get the results that you want. So NGB-R in a nutshell, before we move on to the actual approach to bioprinting, which I think is the most interesting topic here. NGB actually stands for Next Generation Bioprinting. That's a platform that we've designed to make more complex and functional tissues. So it's based on a cytocentric CAD software, so computer-assisted design, that helps you design your tissues from scratch. It's also based on high-resolution bioprinting and robotics. I'm definitely going to explain what I mean by that later on. And onboard maturation monitoring tools to help you better design those tissue layers in the first place. So NGB exists in 2 different versions. There's one for translational research called NGB-R, which is available now. And another version is NGB-C for clinical and therapeutical applications. So it's not available yet. We're hoping that it will by 2023. And the idea behind NGB-C is to equip hospitals and clinics with on-site bioprinting solutions for implants, starting with skin tissues and skin patches. So this is what NGB-R looks like. So it's a pretty bulky instrument, very space consuming, to be honest. That's actually the main disadvantage, to my opinion. But the cool thing is that everything is integrated within a safety cabinet. So it's a custom-made Type 2 cabinet, which you can use for all your cell-related work and, of course, bioprinting work. That big white piece of equipment that you see standing here in the middle is a robotic arm, which will basically operate all the printing job that you request the bioprinter to do. And so the idea here is that the whole process is as automated and reproducible as possible. So we've tried to take the human manipulation or error possibility out of the picture as much as we could. The whole system is then operated through a touchscreen interface, That's a pretty large screen with an onboard software that's already installed that you use to either load your printing sequence or start it, stop it, clean up the equipment, and so on. So literally everything you can do with NGB-R is operated through that screen. Then you've got different bioprinting heads. We're going to spend some time explaining what those are, because there is not one but several bioprinting techniques embedded within the instrument. And as an option, there is also a built-in microscope that you can have if you want to take your work a bit further. So, for example, with quality control and image analysis. Now, I've just mentioned that there are several bioprinting techniques embedded, and there's not one, but actually 3 different technologies here with NGB-R. Starting with bioextrusion. So if you guys are already a bit familiar with bioprinting, I'm pretty sure you've heard about bioextrusion. This is what 80 to 90% of bioprinters out there in the market actually feature. So here we're literally printing a bioink, so a mix of cells and biomaterials in the shape of filaments in XYZ. So it's pretty conventional, if I may say. Then you have inkjet, which we also call microvalve. It's also a nozzle-based technology, but it's not printing filaments, but drops, average drops up to 100 nanoliters. And that's more suitable for stable and liquid types biomaterials. And so in the heart of NGB-R, that's actually the most interesting technology is, of course, laser bioprinting. And so laser, unlike extrusion and inkjet, is a nozzle-free technology. So there's no nozzle, there's no shear stress happening here. And it's printing very tiny droplets of from picoliters to nanoliters. And what's really different here is that you can print either hydrogels, bioinks, or just cells in their medium. And so this is what makes that different approach, which I will introduce in a minute. As I've said before, NGB-R is also a software suite. So there is a CAD software that you can use to either design your tissues from scratch or import an STL file and then slice it to better print it later. There is also the onboard machine interface. So that's the one installed on NGB-R on the touchscreen that you've seen. And as an option, you can also have an image analysis that usually comes with the microscope. So let's get started. You know, this was kind of an introduction. I'd like to really get into the topic. I've tried to make this as user focused as I could, and mention as many possible applications as I could. So I hope it will be of interest for you. So this different cytocentric approach that we have and that is enabled by NGB-R is based on 3 main components. And the first being that you don't need to rely on commercial bioinks. I know it's a pretty bold statement. Just to clarify, if you want to rely on bioinks, you can, of course, because the technologies is the same as with other bioprinters, with, for example, bioextrusion. But this approach doesn't require you to do so. So there's no need to waste time and money on bioinks. And of course, I'm going to get into details about that. The second component here is it's all about 4D bioprinting. So how to optimize tissue morphogenesis through designing micro patterns of tissue components when it comes to bioprinting. And last but not least, the fact that we heavily rely on onboard imaging devices, for example, maturation monitoring tools, as I've mentioned, to take those bioprinted tissues further. So we're going to start with that bold statement of the fact that you don't need to rely on commercial bioinks. So what do I mean by that? If you look at another bioprinter, their business model is, of course, they're selling the bioprinter, but if you look at selling, for example, the more money they make is actually on the bioink they sell. So bioinks is usually a mix of living cells and a biomaterial, so-called extracellular matrix, that is all mixed together and that you can extrude with their machine. Here, it's it's not the way we work. So we call the bioink just living cells and their medium together, and both the extracellular matrix and the bioink are actually printed separately with a different bioprinting technology in NGB-R. So cells are printed using the laser-assisted bioprinting head, while the extracellular matrix, so hydrogel and biomaterial, is printed using a nozzle-based head. And so the idea here is to better address tissue complexity through multimodal bioprinting. So why do we do that? That's the million-dollar question. There's a series of advantages to print cells using laser. And the first main advantage here is cell viability. As I've said before, laser is a nozzle-free technology, so there's no shear stress here. There's no risk to either damage or injure cells in the process. Plus, as you can see in the video, I hope it's playing, you can print up to 10,000 droplets per second, so it's pretty fast. And of course, the quicker the bioprinting process, the better it is for cells, of course. A second advantage is resolution. So by playing on different parameters, you can change the resolution level that you want to print with. So you could print from spheroids and aggregates to cellular spots of say 10 to 15 to 30 cells per droplet, and all the way down to single cell bioprinting with a pretty good success rate of 50 to 70%. So I'll tell you later how you can play on those parameters and what those parameters are, but resolution can be adjusted with the laser technology. And last but not least, well, I'd say to me, that's the main advantages. That's the main reason why using laser for cells is patterning. So unlike other nozzle-based technologies with which, as I said, cells are already mixed up with the extracellular matrix, and you cannot choose exactly where cells will be distributed. With laser, you can spatially organize cells in 3D within the extracellular matrix itself, and according to a specific pattern that you've designed in the first place. So the main idea here is that you can better induce tissue biological functions by doing so. So here's how it works. We always start by printing a primary bed. So it's just a thick layer, we call it a bed, of soft biomaterial to ensure that cell droplets will land smoothly and to ensure that cell adhesion and adherence will be as good as possible. If you don't do that, if you directly print cell droplets onto a receiver, there's a high risk and chance that those droplets will literally burst when landing on the receiver, and then cell viability will definitely go down. You're going to lose a lot of cells in the process, and you're not even sure that those cells will properly adhere to the tissue that you're trying to make, which is a pity really. So we always start with the first layer of soft biomaterial. Then, of course, we start printing cells using laser with a specific pattern here. And so, if necessary, we can repeat that process over and over, layer by layer, and every step of the way of the biofabrication process. So I've taken an example here of Poietis. Poietis was our first human bioprinted skin tissue model that we've initially commercialized. We no longer sell it, but we used to. And as you can see, it's exactly the same process. So for the dermis, we start by printing a first thick layer of collagen 1, on top of which a first layer of primary human fibroblasts are printed, and we just repeat that process over and over. I think it's a total of 12 to 15 layers tops to get a pretty solid dermis. Then after a 3 to 5 day maturation time, we go back to biofabrication with keratinocytes this time. Only one layer suffices. And there's a second maturation time afterwards. But basically, we're using laser to print cells, may they be fibroblasts or keratinocytes, and we're relying on inkjet bioprinting for collagen layers. So when you look at this with the microscope, this is what you can observe. So here, a first layer of fibroblast was printed on that bed of collagen. A second layer of collagen was printed on top, and then again, a second layer of fibroblasts. And so what we're interested in here when doing those experiments is making sure that the initial cell pattern that we came up with is properly maintained throughout the process, layer after layer, and that positioning is as precise and as accurate as possible. And so this is what we ended up with. So that's just a histology illustration of Poietis, but we're pretty pleased with that because it really looks very similar to an organic skin tissue that we could observe separately. We do have an application note on this if you're interested. I'm very happy to share it with you guys later on. Feel free to request it. I think there's a chat or something on Zoom, but feel free to request it. I'll shoot you an email with the application note. It's about 8 pages and it goes into it's very detailed in terms of all the steps that we follow to come up with this. Here's just another example of a totally different tissue that we experimented with. That was for Servier Pharmaceuticals, so a pharma group here in Europe that was interested in drug testing when it comes to hepatotoxicity of drugs, so making sure that lesions are avoided in the preclinical phase. So we've printed liver tissues, many different ones for them, and that's just an example of hepatocytes. So this was why we actually print cells separately from the ECM. Now, 4D bioprinting is a really interesting topic, and we're actually going to dig deeper into those patterns. So how do we optimize tissue morphogenesis through micro patterns of tissue components? Remember, the statement I made in the beginning was we design NGB-R to make more functional tissue. So we're really interested in making sure that the tissues that we bioprint can be useful for a series of reasons afterwards. So what do we mean by 4D bioprinting? That's what usually people are wondering, because it could mean everything and nothing at the same time. Basically, the way I understand it is we take time into account when it comes to designing those cell patterns that I've mentioned before. So we know, tissue functions, biological functions take time to emerge. And what we could observe is that not every pattern is going to lead to the same result. We can control the actual morphogenesis by better defining those cell patterns in the first place. And so we've actually experimented for years and years with different cell types to figure this out. And so I'd like to give you some insight into that, because I'm sure that can be of use for you. So that's an example of a pattern, a micro pattern that we can design with the CAD software. So the software that comes along the instrument. Here it's just like a 68 droplet pattern, pretty standard, very basic, but those are cell droplets printed with laser bioprinting. And so we start experimenting, playing with either the cell concentration, so that's the volume of bioink on the donor, on the laser donor, and power. So what we call power is the laser beam energy level, because you can actually adjust that as well. And by playing with those, we start getting results. So for example, here with a pretty low energy level and a pretty low concentration, well, we see that the pattern is, it's not too bad, but it's still incomplete. And we have from 0 to 5 microbeads or cells per spot. So we can increase that cell concentration and power and start getting different results. So here we see that with 3 microjoules, for example, and 10 microliter of bioink, the pattern is perfectly complete. We've got about 30 microbeads per spot. And so this is how we actually optimize those micro patterns. This is with microbeads because sometimes cells can be expensive. And that's what we usually do for customers as part of a pre-sales trial. And then we usually move on to actual living cells, of course. So here's just an example with keratinocytes and fibroblasts, for which we've defined what's the optimal range in terms of concentration and laser energy to have 20 cells per droplet, 10 cells per droplet, or 3 cells per droplet, depending on what what outcome you're looking for. And so once we figure this out, then we start printing cells according to the pattern that we've defined, and we keep track of that pattern over time to see and monitor how biological function emerged, whether a cell proliferated, migrated, and so on. So here's just a time-lapse video showing a pattern of fibroblasts that was tracked over time. And as you can see, that is properly self-organizing after being bioprinted. And you can actually take that further by changing the cell concentration on the donor level, so with the laser technology. And as you can see, even with the same pattern, but a different quantity of cells per drop, the outcome is totally different. So again, there's a simple way in which we can give you figures, and you can start making a tissue, but you can also optimize that protocol by adjusting very few parameters and see what you get in the end. And so this is really interesting. The last part of this different approach that we try to promote and advocate for is onboard imaging. So, once we have that, what do we do? Well, we'd like to take bioprinting a little further still by relying on live imaging. So Viewprint is just the perfect example for me to give, because it is an optional feature that comes with the microscope that allows you to do target printing. So what is target printing? Well, you can pre-visualize the receiver on which you wish to print cells. It could be a tissue on which you've already printed cells, or a new one, but you can pre-visualize the receiver, and then at the touch of your fingertip, you could select the area or areas on which you wish to print cells. And those cell droplets will be printed exactly where you've selected on the screen. And because it's a live imaging device, then you can also control post-printing and afterwards whether cells have properly printed where you wanted them to. So Viewprint lets you work on classic receivers. What I mean by classic receiver is a Petri dish or a 6-well plate, a 12-well plate, by printing cells on pre-existing pattern cells. But you can also work on specific devices. This is for one of the people I've talked with. I'm sorry, I forgot your name. You guys are several today, who mentioned that he was interested also in special devices like organ-on-a-chip devices. Well, Viewprint is a cool feature to have for that reason, because you can also print in precise and confined areas on a microgrid arrays, for example. Another application of Viewprint could be the induction of spheroids and organoids. So you can play on the local concentration of cell, and you can print cells over existing cells to create aggregates, clusters, and spheroids. And so this is something that we've done several times in the past, very successfully. Those images below are actually from a partnership with L'Oreal. But we've also experimented with organoids for the brain models that we designed for neural disorder studies as part of a consortium that we have here in Europe. And it's really interesting to be able to do that. So it's actually yet another function of bioprinting that can be, how would I say that, explored thanks to imaging, onboard imaging. And to finish with, well, of course, it's also about image analysis. So the fact that you can reconstitute every single layer of your bioprinted tissues in 3D, but all the analysis that you can perform on the images as well. So how it works is basically after you've printed cells with laser, so it could be any layer really. Sorry, just gonna sip some water. The robotic arm will take your receiver right to the microscope in order to take a picture of what you've just printed. And thanks to the software that comes with the microscope and based on machine learning, it could automatically count cells, for example, and then tell you whether a specific drop was not valid in terms of percentage. So, for example, if you need to have more than 70 cells per droplet and a spot has only 43 or 50 or 13, whatever, then the software could tell you, wait, there's one spot missing here. Do you wish to print back to get more cells in that drop? I mean, a series of options like that are enabled by imaging as well. So just to sum up, and I've actually added this slide because sometimes it doesn't really make sense. You could use NGB-R for this cytocentric approach that we have, which means printing cells with laser and the extracellular matrix with nozzle-based technology. But as I've said before, you can also use NGB-R in a more conventional way. So what do I mean by that is you can use it for commercial bioinks, cell-loaded bioinks, or cell-free biomaterials, for example. And the laser head could also be used to print well, patterns of hydrogel, for example, as you can see in this image here. So really, you can pretty much do everything, if I may say, with the instrument, from printing just hydrogels or cells. But the idea here is that you can work with cells in a better way, with cell patterning and so on. So I'm done here. I'm not sure if you have questions. I'll be really happy to answer them.